Good morning viewers and my dear students. I Dr. Megha Choudhary welcome you all in my surgery online class, and today topic of discussion is spots puffy tumor. Actually it is not a tumor or a cancer. It is a misnomer. It is not a tumor. It is only a pot filled of pus. It is formation of diffuse external swelling in the scalp due to subperiosteal pus formation and scalp edema. So you will notice in this picture a edema and a swelling that is full of pus. In etiology, we have to understand 4 points. That is, first is frontal sinusitis. This is the main cause. When sinusitis is long-standing chronic, that can lead to suppuration and extends into subperiosteal region. Then second is frontal trauma, that can lead to subperiosteal hematoma and then infection. Third one is chronic suppurative otitis media. And then fourth one is post-surgical, that is after frontal sinus reconstruction. Now let's understand the sinusitis, complication of sinusitis. When there is long and chronic sinusitis, as we all know, there are 4 types of sinuses that are hollow cavities in our skull. When frontal sinus is involved, that can lead to infection of bone marrow, that is osteomyelitis. Frontal bone involved होगी, and frontal bone जब involved होगी तो वहाँ पे pot puffy tumor होगा, that is collection of pus. It is nothing, it is collection of pus. Here is the picture of 4 type of sinuses: frontal, maxillary, ethmoid and sphenoid. So when frontal sinus is involved, जब कोई long persistent congestion है, कोल्ड कफ हो रहा है पेशेंट को, तो क्या होगा, वहाँ पे जो होलो स्पेसेस हैं वहाँ पे म्यूकस एक्यूमुलेट हो जाएगा. रेस्पिरेटरी सिस्टम इज व्हेन इन्वॉल्व्ड एंड देयर इज लॉन्ग chronic cold and cough, that can lead to the accumulation of mucus into this sinuses, frontal and maxillary. So when frontal sinus is involved, वहाँ पे inflammation हो गया, sinusitis हो गया frontal sinus के अंदर, तो that can lead to the collection of pus. This pot puffy tumor is nothing, it is the collection of pus and pus, nothing else. So in treatment it needs a proper drainage. Now let's understand it better. Here is the diagram. Skin periosteum is shown, and let's understand when the infection is beneath the periosteum, that is the layer of bone. See here, pot puffy tumor is marked with blue pen. There is a inflammation and collection of pus beneath the periosteum, and when this infection spreads more deeper into the dura mater, extradural abscess occur, and when inside the dura mater, then subdural abscess occur, and this infection goes on deeper. So that's how this can lead ultimately to brain abscess, also to cavernous sinus thrombosis. So here you can see this is marked with blue pen, swelling on the frontal bone, and when this infection enters deeply inside the dura mater, when it invites the bone, then it causes osteomyelitis, then it reaches to meninges and causes meningitis, and then it reaches more deeper and causes subdural and extradural abscess formation, and then brain abscess when it reaches into the brain. So complications: osteomyelitis of front bone, and when intracranial abscess occurs, because that will cause intracranial pressure, that will increase the intracranial pressure also, and this will lead to the symptoms like headache, convulsions, toxicity and drowsiness. Brain abscess and cavernous sinus thrombosis are later manifestations. In pot puffy tumor, clinical features are pain and boggy swelling in frontal region, which is warm and tender to touch. There is toxicity and drowsiness. Pitting scalp edema, you can easily notice the edema, characteristic pitting scalp edema on that side where is that pot puffy tumor. Now in investigation, there will be elevated ESR, total leukocyte will also be elevated, because in case of every infection that gets raised, Then patient will be recommended for X-ray skull, ultrasound to exclude frontal bone osteomyelitis, CT scan and MRI for proper visualization. So here is the picture of the imaging where you can easily identify the swelling. In treatment, surgical drainage is the first step because it is very necessary to drain that pus. Once it extends into cranial cavity, it is treated accordingly by formal neurosurgical decompression, often using Dandy brains cannula. Osteomyelitis of skull bones require radical removal with reconstruction of skull defect. Along with antibiotics are needed.